Before starting the insulin therapy in any individual patient, the patient's background should be considered, whether he is from the rural setting or from the urban setting, and whether the patient have a facility to keep the insulin in the freeze or like in cool environment or not. And second important thing to start with insulin therapy is to make the patient comfortable with this kind of therapy, and just to explain that the life before giving the insulin and after giving the insulin will be modified. And before patient having very high blood sugar that can be controlled by insulin, he will be a much better life and less pain and less complications and less side effect of diabetes than without insulin. So all these things should be considered before starting the insulin therapy, and patient should be explained all the measures, and he should be explained that no other way by that it can be controlled, and the insulin is the best therapy for him to control the blood sugar. And for control of the diabetes, I think the most important factor is the lifestyle modification. Before starting any kind of therapy, the lifestyle modification is the most important thing, and this thing should be explained to the patient in detail. And I think the lifestyle modification has the highest and the most effective way to control the sugar before the starting of the therapy. To control for the lifestyle modification, the patient has to be explained regarding the regular physical exercise, diet modification, and to take the proper diet and to take the medicines regularly. And it should be explained to the patient regarding the complications of the diabetes. If the patient is not able to control his blood sugar level, so the various complications can be occurred. That should be explained to the patient, so that patient can be apply for his diet and for lifestyle modifications.